Eating Disorder Awareness Week is an international awareness event fighting the myths and misunderstandings around eating disorders such as anorexia, bulimia, and binge eating disorder. This year's theme is focused around the hashtag Help Men Get Help. This is because 1 in 4 people with an eating disorder are male. However, due to social stigma and stereotypes, the symptoms can go unnoticed by those around them, making it harder for them to access professional support. In this video, we're going to talk about the different types of eating disorder and share some useful tips on how to have a supportive conversation. Anorexia or Anorexia Nervosa is a mental illness where people are of low weight due to limiting how much they eat or drink, over-exercising, or a combination of the two. The way that people with anorexia see themselves is often at odds with the way that others see them. They often have a distorted image of themselves and think they are larger than they really are. This is often characterized by a deep fear of gaining weight, as their body shape can play a big role in their sense of self-worth. Due to the effects of starvation on the body, anorexia can cause severe physical problems, including loss of muscle strength and reduced bone density. In addition, people whose periods have previously started may find that they become irregular or stop. Anorexia can affect people's relationship with family and friends, causing them to withdraw, and as with other eating disorders, is also associated with depression, low self-esteem, alcohol misuse, and self-harm. The physical and emotional consequences of anorexia can often go unacknowledged or unrecognized, as sufferers often go to great lengths to hide their behaviors from family and friends. Other common signs of anorexia include, but are not limited to, excessive counting of calories, avoidance of eating around other people, or wearing baggy clothes to make weight loss less noticeable. People with bulimia or bulimia nervosa are caught in a cycle of eating excessive amounts of food, called binging, and then trying to compensate for overeating by vomiting, taking laxatives, or excessive exercise, also known as purging. Binge eating is often a way to cope with difficult emotions. For example, someone may be driven to binge eat if they feel stressed out, upset, or angry. During a binge, people with bulimia don't feel in control of how much or how quickly they're eating, potentially even feeling disconnected from what they're doing. Similar to anorexia, people with bulimia place a strong emphasis on their weight or body shape and can often see themselves as much larger than what they actually are. The binge-purge cycles associated with bulimia can dominate daily life and cause difficulties with relationships and social situations. If someone is developing bulimia, changes in behaviour will become noticeable before changes in physical appearance. These signs can include, but are not limited to, disappearing during or soon after eating, and either frequently checking or avoiding looking at their body shape. People with binge eating disorder eat large quantities of food over a short period of time. However, unlike people with bulimia, this isn't followed by attempts to get rid of the food through purging. The characteristics of a binge eating episode can include eating faster than normal, eating large amounts of food when not hungry, or eating alone through embarrassment of the amount of food being eaten. During a binge, people may go to extreme lengths to access food, including eating food that has been thrown away or that doesn't belong to them. Someone who experiences one of these episodes a week for 3 months or more is likely to be diagnosed with binge eating disorder. People often experience feelings of guilt and disgust at their lack of control during or after a binge, which can reinforce the cycle of negative emotions, restrictions, and binge eating again. The triggers for binge eating can vary and could include overwhelming feelings such as feeling low, angry, bored, upset, or anxious. Alternatively, people may also binge eat when they are feeling happy or excited. There are a number of ways that binge eating disorder can impact somebody's life, including an increased risk of weight gain, high blood pressure, heart disease, and type 2 diabetes. It's also linked to low self-esteem, lack of confidence, depression, and anxiety. The signs and symptoms of all the eating disorders we've spoken about can vary from one person to another. If somebody's symptoms don't match up with what the doctor needs to make a diagnosis, they may be diagnosed with OSFED, which stands for Other Specified Feeding or Eating Disorder. It's also important to remember that eating disorders aren't about food or weight and are more representative of a person's attempts to deal with or control a stress-related issue. In addition, they are complex and often coexist with other mental health issues. If you are going to approach a friend, colleague, or significant other with a view to having a supportive conversation about their eating habits, avoid doing this at a time or setting related to food, focus on feelings rather than diet, shape, or weight loss, and be mindful not to try and force change or blame the individual you are trying to help. Lastly, be sure to signpost appropriate professional help by way of a GP who can diagnose and refer to a specialist. If you are a wellbeing and inclusion leader that wants to reduce mental health stigma in the workplace and raise awareness of the factors that keep inequality in place, Mental Health First Aid is a 2-day workshop designed to give your team the confidence to spot the signs of poor mental health in themselves and those around them, the skill set to listen non-judgmentally and have supportive conversations, and the knowledge to signpost those who need it towards appropriate professional help. Get in touch with myself via info@letsgowellbeing.com for more information, and don't forget to subscribe to this channel for more news and views from the world of wellbeing.